All right. Welcome back to NeuroClarity, the podcast that simplifies clinical neurology one case at a time. I am Honorary Victor, your host, and today we are zeroing in on a deceptively simple multi choice question. This is a question that tests your grasp of cerebral venous anatomy. Now, it might seem like a one liner, but the depth behind this single question unlocks a treasure of anatomical and clinical insight. As usual, our cases are derived from Ching and Cheng's comprehensive review of clinical neurology. We are currently in chapter 2 and we've done questions 1 to 58. This is question 59. That being said, let's get started. Question 59. Which of the following is incorrect regarding the venous system? A. Veins of the scalp communicate with the dural venous sinuses via emissary veins. B. Ophthalmic vein drains into the cavernous sinus. C. Cavernous sinus drains to the superior and inferior petrosal sinuses. D. The vein of Labbe is the superior anastomotic vein. And E. The vein of Rosenthal is a deep vein. What do you think? Now, let us cut the chase. The correct answer is D. The vein of Labbe is not the superior anastomotic vein. In fact, it is the inferior anastomotic vein. Let's break that down and much more. In order to understand this, or rather memorize this, you need to think like a neurosurgeon, working layer by layer. We're going to walk from superficial to deep, like we're opening up the head and peering into the brain. Let's start with the superficial veins. These veins lie in the subarachnoid space and they drain the cortical surface of the brain. They primarily empty into the superior sagittal sinus, the transverse sinuses, or the sylvian vein, also known as the superficial middle cerebral vein. Now, two key anastomotic veins link these superficial territories, and they are the vein of Trolard and the vein of Labbe. The vein of Trolard is also called the superior anastomotic vein, and it runs between the sylvian vein and the superior sagittal sinus. The vein of Labbe, on the other hand, is called the inferior anastomotic vein, and it connects the sylvian vein to the transverse sinus, often overlying the temporal lobe. There's a quick way to remember this. Trolard is top, top is superior. Labbe is lower, lower is inferior. And that makes options D incorrect. Got it? But we're not done yet. We are still going from superficial to deep. After the superficial veins, our eyes hit something we call the emissary veins. These are dangerous highways. The emissary veins bridge the scalp veins and the dural venous sinuses. These veins are valveless, making them bidirectional and, more importantly, clinically dangerous. Infections from the scalp or the face can track inwards, leading to something we call dural sinus thrombosis or cavernous sinus thrombosis. This is an emergency. For the sake of time, we are going to talk about this later on, but options A is correct. Emissary veins are real and they are clinically important. Looking further, we have something we call the cavernous sinus, and this is the crowded crossroads. The ophthalmic vein drains the orbit and it connects to the facial nerve. It pours directly into the cavernous sinus, which sits like a pool on either end of the cellular tussica. The cavernous sinus houses cranial nerve number 3, that is your oculomotor nerve, cranial nerve number 4, your trochlear nerve, cranial nerve number V1 and V2, which are the ophthalmic and maxillary divisions of the trigeminal nerve respectively, and cranial nerve number 6, that is the abducens nerve. It also houses the internal carotid artery. From this cavernous sinus, blood drains superiorly into the superior petrosal sinus and then to the transverse sinus, and inferiorly into the inferior petrosal sinus, which empties into the jugular bulb. So, option B and C are very correct. Now, let's go even a little bit deeper. And now we are dealing with the deep venous system. The deep veins drain structures like the thalamus, the basal ganglia, and the periventricular white matter. And the deep system includes the internal cerebral veins and the basal vein of Rosenthal. The internal cerebral veins are formed by the union of the thalamus striate and the septal vein, and the basal vein of Rosenthal drains the medial temporal lobes and the ventral diencephalon. All these converge into something we call the great cerebral vein of Galen, which then joins the inferior sagittal sinus to form the straight sinus. This runs backward into the confluence of sinuses where major superficial and deep systems meet. So, option E is correct. The vein of Rosenthal is indeed a deep vein and it drains the base of the forebrain. That was a mouthful. The question is, why does this really matter? Remember the vein of Labbe? Yes, Labbe, lower, inferior, the inferior anastomotic vein. We said that that vein connects the sylvian vein to the transverse sinus and it's often overlying the temporal lobe. As such, thrombosis in this vein can cause temporal lobe infarct, and you got it right, it can mimic a stroke. How about cavernous sinus thrombosis, our crossroad? Think of all the cranial nerves that lie in this place. You can have deadly cranial nerve entrapment. Think of proptosis, ophthalmoplegia, chemosis. Remember, variability is a norm in venous anatomy, and some people have hypoplastic or absent sinuses, making them more vulnerable to congestion or hemorrhage after trauma or surgery. That being said, I would like to mention four things that the neurosurgeons always tell their residents. 1. Venous sinuses have no valves. As such, pressure can shift bidirectionally. 2. Veins are more fragile than arteries, especially during retraction or head trauma. 3. In posterior fossa surgery, understanding petrosal sinuses is vital to avoid venous infarct. And 4. On MRI, veins are often best visualized on MRVs, that is magnetic resonance venography, or SWI sequences, that is susceptibility weighted imaging. Let's do a quick recap. Remember, Trolard is top, Labbe is lower, Rosenthal runs deep, and emissary veins are entry points for infection. So, back to our question. I am pretty sure the option D sounds like a very big lie to you. It's obvious, right? Labbe, lower, lower, inferior. Option D is the incorrect option. Cerebral veins might not pulse like arteries, but they are just as vital. A small misunderstanding, like mixing up Trolard and Labbe, can lead to a major miss in diagnosis or even surgical planning. Keep your concepts clear, keep your anatomy sharp, and keep your neuro game strong. Thanks for tuning in to NeuroClarity. If you enjoyed this deep dive, you can subscribe, you can like, you can share, and you can even let us know what topic you want us to dissect next. Until next time, stay curious, stay sharp, stay clear, and bye for now.